Okay, let's talk about angiolipoma. General background. Angiolipoma is a relatively common, small, benign subcutaneous adipocytic lesion with a variably prominent capillary-sized vascular network. Patients frequently present with multiple lesions, solitary in only one-third of patients. That can be painful, especially on palpation. Most often arise in the upper limbs. Approximately two-thirds are seen in the forearm, trunk, and lower limbs of young adults. Peak incidence is between the second and third decades. They most frequently affect men. Angiolipomas are well circumscribed, encapsulated nodular lesions, most often smaller than 2 centimeters. Angiolipomas have a mature adipocytic proliferation, variably associated with a capillary-sized proliferation that tends to be more prominent at the periphery. Clinically, local pain is observed not only in angiolipoma, but also in other histologically unrelated subcutaneous nodular lesions, such as angioleiomyoma, eccrine spire adenoma, schwannoma, glomus tumor, and others. Cellular angiolipoma. The amount of capillary proliferation is predominant, and the adipocytic nature of the lesion may be overlooked. Lesions of this type have been mistaken for Kaposi sarcoma. Lack of immunostaining for HHV8 is particularly useful in excluding Kaposi sarcoma. Intramuscular hemangioma. It is a deep-seated lesion in the past called infiltrating angiolipoma. It shows frequently an adipocytic component. It is differentiated from angiolipoma by lack of encapsulation, fibrin microthrombi, multiplicity, or subcutaneous location, that is, deep location. Angiolipomatosis. multiple angiolipomas. The majority of angiolipomas occur sporadically. There are a minority of cases that have been associated with autosomal dominant familial angiolipomatosis, the use of certain medications such as indinavir, a protease inhibitor used in the treatment of HIV, long-term corticosteroid, long-term immunosuppression. Multiple angiolipomas are much more common than solitary ones and account for about two-thirds of all angiolipomas. Prognosis. Angiolipomas are benign. Local excision is curative and virtually never recurs. There is no evidence that this lesion ever undergo malignant transformation.